We have a 1-year-old baby presenting with vomiting and abdominal distension. Initial imaging with a plain abdominal radiograph shows a large soft tissue mass in the center of the abdomen displacing bowel gas. There's no calcification visible, which is important to note at this stage. Next, a contrast-enhanced CT of the abdomen and pelvis was performed. The CT shows a large soft tissue mass centered around the left adrenal gland with areas of calcification and cystic degeneration. What's striking here is that the mass is completely engulfing the coeliac axis and stretching it, indicating an aggressive nature. We also see involvement of the right para-aortic region with lobular contours, suggesting local lymph node spread. Thankfully, no liver metastases are seen, and the kidneys are separate from the mass with normal function, without any signs of hydronephrosis. The MIBG scan then confirms the diagnosis. It shows avid tracer uptake by the abdominal mass, typical of neuroblastoma, and it also reveals widespread skeletal metastasis. These metastases involve the skull, scapulae, femora, tibia, spine, and pelvis. Despite this, the salivary glands, heart, liver, and bladder show normal uptake, so they aren't affected. So this is a case of metastatic neuroblastoma stage 4. Neuroblastoma is the most common extracranial solid tumor in children. It arises from neural crest cells and can occur anywhere along the sympathetic chain. In this case, the left adrenal gland is the primary site. The tumor's behavior, engulfing vessels like the coeliac axis and involving local lymph nodes, is typical for neuroblastoma. Now, while Wilms's tumor could be considered a differential, a few features set it apart. Wilms tends to affect older children, it's less likely to calcify, and it usually displaces vessels rather than engulfing them. Plus, Wilms doesn't take up MIBG, unlike neuroblastoma. For management, we need to assess whether there's spinal canal invasion, especially with the widespread skeletal metastasis. MRI might be needed if there's any doubt on CT. Additionally, a 99 milli-TC bone scan can help delineate the extent of skeletal involvement, especially since not all neuroblastomas are MIBG avid. Finally, an urgent referral to a pediatric oncology team is necessary to get this child the comprehensive care they need.